Welcome to our demo session. This session goes in a way how this course works. You may have some doubts and send your doubts to our WhatsApp number like why is blood sugar estimated? What is the importance of vital signs? How do we manage a pregnant patient with pain? With these doubts, you are contacting our WhatsApp number 8124452856. First step, you are asking your questions. Second step, we will arrange the questions from basic to complex. Step 3, we will process the answers. Once your answers got processed, we will provide you in a pictorial representation so that you will understand easily in a simple way. First comes the vital signs. Vital signs shows the vitality of a human body. Let's know the name of the vital signs we will record. Number 1, blood pressure. Number 2, temperature. Number 3, oxygen saturation. Number 4, pulse rate. Number 5, body weight. Number 6, respiratory rate. Number 7, blood sugar estimation. Number 1, blood pressure. Why to record the blood pressure? The normal blood pressure is systolic by diastolic is 120 by 80 mmHg. Any rise in blood pressure may cause the blood vessel to damage in our body. Blood vessels in the brain may also got damaged at high blood pressures and cause stroke, a blood clot in the brain blood vessels. So we should record the blood vessels, blood pressure. So reduced blood pressure may cause insufficient blood supply to heart and may cause drowsy. Second comes the temperature. Temperature, normal temperature is 98.4 degree Fahrenheit. Any rise in temperature above 100 degrees shows the fever. Fever should be controlled before any treatment procedures, surgical procedures to undertake for a patient. Number 3, oxygen saturation. Oxygen saturation shows the vitality of the human body. It should be 95 percentage in a normal person. So if it reduced to 70, 60 and all, we should immediately administer oxygen because the vitality is assessed with the oxygen saturation. As it is reducing below 78, 60 and all, we should administer oxygen as soon as possible to save the patient. Number 5 is the body weight. Body weight should be calculated with body mass index, height to the weight, height in meter square by number of body weight in kg. So with this we will calculate the body in a lean or obese. If the patient is obese, he will he may have joint problem or a ligament tear. If the patient is lean, it is classified into short term and long term. Short term lean person become lean within months, we can suspect tuberculosis and cancer. Long-term lean patient may be due to nutritional deficiency also. Number 6 is respiratory rate. Respiratory rate helps to assess respiratory diseases. Number 7, blood sugar estimation. Normal blood sugar, again, respiratory rate is 12 to 15 beats per minute. Pulse rate. Pulse rate is recorded with its beat, number of beats per minute, and also the rhythm. Number of beats, normal beats of pulse rate is 72 beats per minute, and the rhythm is recorded to rule out any heart diseases. Blood sugar is estimated. Why? Because normal blood sugar is fasting 70 to 110 mg per dl and postprandial 120 to 140 mg per dl and HbA1c less than 7 percentage. If the blood sugar is elevated, it may lead to microbial overload, and in the persons with uncontrolled infections, we may suspect elevated blood sugar. What is the relation between the microbial overload and blood sugar level increase? Elevated blood sugar may cause the bacteria in our body to take up the nutrition and elevates their colony levels, so that the infections in the body is not controlled. This is the mechanism behind. So we should maintain the blood sugar, fasting blood sugar at 70 to 110 mg per dl. Again, low blood sugar may cause insufficient nutrition to the body, and the patient may become weak and drowsy. This is the importance of the vital signs we are recording to our daily patients we are seeing. So the next question comes the blood sugar estimation. As we said earlier, the blood sugar is related to the microbial overload. Next comes the dental care in pregnancy. If the patient came with a pain and he is pregnant, we should first examine the patient and let her know that cause for dental pain. But we can't do any treatment in the first trimester and the second and third trimester, because at first trimester the fetus is undergoing organogenesis. That is, the fetus is developing its organs. Any stressful procedures at this stage causing the mother to stress may affect the development of organ of the fetus. So we should avoid any treatments at organogenesis stage, that is first trimester. At third trimester, why we should avoid dental treatment? At third trimester, the fetus is almost got developed, but it is ready to de- delivery. It is close to delivery, almost developed, but the fetus should be completely developed for 9 months. If we are stressing the mother, there may be a preponderant delivery which we should avoid, but we can do the dental treatments, that is elective dental procedures at second trimester with the opinion of the gynecologist. So in this way we are able to understand simply in pictorial representation. You can ask your questions at our WhatsApp number 8124452856. Also, it is free for first three questions.